Imagine you're in the middle of a complex operation. The lights are bright, the room is filled with the quiet hum of machines, and every member of the team is tuned into their role. The atmosphere is tense but focused. The air is still, the team focused, until a sudden alarm shatters the calm. Instantly, the energy in the room shifts. Everyone looks to you for direction. The patient's heart rate drops, oxygen levels fall. Every second counts. Panic isn't an option. In these moments, your training and mindset are put to the ultimate test. Your mindset is your greatest asset. It's what allows you to stay steady when everything around you feels uncertain. This is where an outstanding operating department practitioner stands out, not just by knowing what to do, but by staying calm and thinking clearly under pressure. Your ability to communicate and lead can make all the difference. The operating theatre is a place of precision and teamwork, but things can change in an instant. Adaptability is key, and your mindset shapes how you respond to the unexpected. Remaining calm and decisive is the foundation of patient safety. Your presence reassures the team and the patient, even in the most challenging situations. Your mind can be your ally or your obstacle. The thoughts you choose to focus on will guide your actions. Mastering your internal state is as crucial as mastering the equipment. Both require practice, patience, and self-awareness. The difference between good and great ODPs is mental fortitude, confidence, humility, and resilience. These qualities are built over time through experience and reflection. When alarms sound, the team relies on you to filter the noise, identify the problem, and act without hesitation. Your clarity under pressure inspires confidence in others. This mindset isn't innate, it's built through practice, reflection, and commitment. Every experience, whether a success or a challenge, shapes your mental approach. Your reaction to stress is a choice. You can train yourself to pause, breathe, and focus before you act. You can let adrenaline overwhelm you, or you can harness it. Channel that energy into clear thinking and decisive action. Train your brain to see crisis as a problem to solve, not a threat. This shift in perspective empowers you to act effectively. In this video, we'll explore how to develop this powerful ODP mindset and turn pressure into performance, so you can be ready for anything the operating theatre throws your way. What is clinical judgment? It's a term you'll hear often, but what does it really mean in the heat of the operating theatre? It's your ability to quickly piece together information and make the best decision for your patient, even when the situation is changing by the second. It's not just textbook knowledge, it's applying what you know in real time, under pressure, when there's no time to second-guess yourself. As an ODP, you're constantly observing, assessing, and anticipating. You're the eyes and ears for your patient when they can't speak for themselves. Your clinical judgment is your internal compass, guiding every action, every adjustment, and every call you make. You assess the situation. Vital signs, breathing, skin color, blood loss, stage of surgery. You notice the small details that others might miss. Then you prioritize. Not all information is equal. A drop in blood pressure may be less urgent than a blocked airway. You learn to filter the noise and focus on what matters most. Once you identify the priority, you act decisively. Hesitation can be costly, so you trust your training and experience to guide you. Clinical judgment also means knowing your limits and escalating when needed. Clear, calm communication is key, especially when the unexpected happens. Developing this compass takes time and experience. It's not something you're born with, but something you build with every shift. Every case, every challenge, every mistake builds your judgment. You learn from your colleagues, from feedback, and from reflecting on your own actions. Over time, you learn to trust your instincts and recognize subtle patterns before the monitors do. Your intuition becomes sharper with every experience. This blend of intuition and training forms the bedrock of strong clinical judgment, allowing you to act with confidence and clarity. It's what makes you indispensable in the operating theatre and what ultimately keeps your patients safe. In the operating theatre, demands come at you all at once. The art of triage is essential. Use a clear framework, the ABCD approach: airway, breathing, circulation, disability, exposure. This mental checklist should be second nature. For example, you're helping with intubation, a phone rings, and the patient's oxygen drops. What's the priority? Airway and breathing always come first. Ignore distractions. Focus on restoring effective breathing and securing the airway. The phone can wait until the patient is stable. Instantly categorizing and prioritizing tasks keeps patients safe. Always ask, what's the most immediate threat to my patient's life? Filter every request through this lens to cut through the noise. This discipline prevents distraction and ensures your actions align with the patient's needs. It's a simple, effective way to make the right call every time. Knowing what to do is one thing, doing it calmly under pressure is another. In the operating theatre, the stakes are high and every decision matters. Staying composed isn't just a personal benefit, it's essential for patient safety and team performance. Stress triggers adrenaline and narrows your focus, helpful in danger but not in surgery. When your mind races, it's easy to miss details or make mistakes. You can override this response. With practice, you can train your body and mind to stay steady even when the pressure mounts. Start with your breath. Slow, deep breathing calms your nervous system. Just a few intentional breaths can reset your focus and help you regain control. Practice box breathing. Inhale for 4, exhale for 6. This simple technique can be done anywhere, anytime, and is proven to reduce anxiety. Make it your automatic reset. Communication matters, especially when the room feels tense. Speak slowly and clearly. A calm tone reassures the team. Your words and demeanor can help others stay grounded. Use checklists and cognitive aids during emergencies. These tools are designed to support you, not replace your expertise. They free up mental space and ensure nothing is missed, allowing you to focus on what matters most. Trust your training and your team. You've prepared for this moment through countless hours of practice and learning. Don't hesitate to ask for help. Clear communication is a strength, not a weakness. It keeps everyone aligned and safe. Lean on your colleagues, you're not alone. Support and teamwork are vital, especially in high-stress moments. By controlling your breath, communicating clearly, using checklists, and trusting your team, you build resilience. These habits make you stronger and more adaptable. These habits protect you from stress and keep patient care at the center. When you're calm, you can give your best to every patient. Calm is contagious. Your composure sets the tone for the whole team. Others will follow your lead. Practice these strategies until they're second nature. The more you rehearse, the more automatic your calm response will become, even in the most challenging situations. To master the ODP mindset, mentally rehearse common high-pressure situations. Take a difficult intubation. The anesthetist struggles, oxygen drops. Stay calm, anticipate needs, and follow the difficult airway algorithm. Have all alternative airway equipment ready. Be one step ahead. Communicate clearly and confirm equipment as you pass it. If saturations fall, be ready to assist further. Your calm support is vital. Another scenario, sudden blood loss. The monitors show falling blood pressure and rising heart rate. Support the anesthetist. Prepare fluids, blood products, and emergency drugs. Use closed-loop communication. Repeat instructions to confirm. Track fluids, blood given, and blood loss meticulously. Breaking down crises into predictable steps transforms chaos into control. Mental rehearsal makes your response automatic and effective. Let's bring it all together. The ODPP mindset is a philosophy, not just a set of skills. It's built on 4 pillars: stay observant, pause to prioritize, communicate confidently, and support your team and patient. Be relentlessly observant, scan the environment, listen and anticipate needs, pause and prioritize. Take a moment to breathe and run through your mental checklist. This prevents panic and ensures logical, calm action. Communicate with confidence, speak up clearly and assertively when needed. Support your team and patient, be proactive, not passive. Confidence comes from competence and commitment to patient welfare. Be a team player, always thinking about how to help and protect the patient. This collaborative spirit is the heart of the ODP mindset. Excellence is a habit built on these pillars. Becoming an outstanding ODP is a journey of continuous learning, self-improvement and habit building. The right mindset isn't simply switched on at work, it's nurtured daily through consistent practice and honest reflection. Lifelong learning, curiosity and a willingness to adapt set great ODPs apart from the rest. Always seek new knowledge, stay open-minded and learn from every single case you encounter. Ask questions, share insights and embrace challenges as opportunities to grow and develop. Regular reflection is key. Debrief after cases. Identify what went well and what could improve for next time. This process turns experience into wisdom and builds lasting resilience. The best ODPs take ownership and responsibility for every patient in their care. They prepare meticulously, communicate flawlessly, and always advocate for patient safety. Their mindset blends humility, confidence, curiosity, and a strong sense of duty. This is what truly defines excellence, mastery of both skill and calm under pressure.